Hello, good day everybody. Welcome to our open online briefing. We'll start in a minute, but it gives me a chance just to greet a few people who I can see popping up on the screen. Sanjukta, hello, nice to see you, smiling. Hello, Paul, how are you? You look well. I know where you are, Paul. I don't know where Sanjukta is. Where are you? Okay, you're putting it on the thing. Geneva, welcome. But I think I saw just now that Rojan, you're there. Namaste. Kapai Nepalma Hunoncha. Lovely to see you.
I'm in Nepal, sir. Good to see you.
Hello, Rojan. Nice to see you, thank you. And then I see my grandson, Isaac, there with his mum, Polly. Hello, Isaac. Nice to see you. And then Linda, hello, welcome to you, Linda Bayer. Nicolene, hello and welcome. And then we've got from Mexico, Tlalpan. I can't read the thing on the screen, but nice to see you. Lily, thank you for joining. Peter Scott Bowden, World Food Programme, welcome. Good that you're here. Joe Colombano, welcome to you. Gabriella, nice of you to join. Vicky Doyle, thank you. Nice that you're on. With all that beautiful work you're doing. Derek Chan, great that you're with us. John Atkinson, thank you. Thank you for being with us. Nice, thanks for your message, Rojan. Yes, the mics may be a bit muted. This is a part of the process of keeping things running smoothly. Oh, very good. Very nice to see everybody. Thank you. I'm going to start now. And I've said colleagues that I wanted this time to talk about COVID and inequality. And really by that, I mean COVID and the differences between those who have a lot of wealth and those who have very little wealth, because I'm particularly interested in considering what is happening for people who are poor as a result both of the virus and of attempts to contain it. And because in these online briefings, we have people who join who haven't been with us before. I'm going to start with a little bit of a recap, and then I'm going to go into talking about the situation as I see it in different countries, and then focus particularly on inequality issues. I'm very keen that you should comment and use the chat system for sharing any questions you've got. About halfway through, I'll introduce you to members of our team, and I'll also tell you a bit about who's coming from where. Sometimes we do try to make space so that if somebody's got something they really want to say, we'll see if we can bring them in. Please don't hesitate to indicate on the chat line if you'd like to say a word for a minute or two relating to inequality issues. We'll see, as I said, if we can. It doesn't always work, and that's why I'm just saying, if there's a chance, I will attempt to do so. Let me just begin at the top. I am consistently saying to everybody, this virus is here to stay. I don't think it's going to go away. It doesn't show any signs of changing its personality. It's very much here, and it is dangerous, and it surprises us all the time. So any underestimation of the potential impact of this virus, I think, is erroneous. It's droplet borne because it's a virus that affects the respiratory tract. And then as you cough or sneeze or even talk, little tiny droplets come out of your mouth or out of your nose, and they can travel up to about 6 feet. And in that way, another person can get infected. And that's the primary mode of infection, which is why we say time and time again that physical distancing is key to reducing the risk that you'll get the disease. And because it is an infectious disease, and it is a highly infectious disease, all the time we say the emphasis is on rapid suppression of outbreaks the very moment they begin. Because if you wait, then the outbreaks build up very rapidly, and you can quickly end up with an explosive outbreak that overloads hospital services and causes many people to become ill and in some cases to lose their lives. I think all over the world, there is an extraordinary sense-making exercise underway where people are coming to terms with the reality that this virus and the way it behaves, and indeed the way societies are going to have to be strong in the face of the virus, basically affects everything that we do. That sense-making is not comfortable. For many of us, it's disturbing, particularly if we feel that we are at risk because of the virus and we feel we need to protect ourselves. So in turn, we're having to think very hard about how we change our lives so that we can keep safe. Some people have said to me, well, perhaps it's not going to be so severe in Africa or in Asia because of the different age structure of the population, or because people have had other conditions. I'm saying that I think it's having pretty bad effect in some parts of Africa and Asia right now, and it looks as though that is set to continue. The intensity of the problem can be reduced by restricting movements in the population, and that then gives the virus less opportunity to be transmitted. But we have to remember that only slows the spread. The lockdowns reduce the rate of spread, but they don't get rid of the virus altogether. And so it's up to us how we're going to come to terms with this virus and live with it. It's up to all of us as members of the human family to adapt our behavior so that we're less likely to become affected as a result of the virus. It's what I call societal defense against COVID. There are 4 areas which I think are important for me to highlight. The first is, if societies are going to defend themselves against COVID and we're going to get on top of it and get ahead of it, that means all of us have to understand as much as we can about the virus and how it's spread, about how we can prevent it through physical distancing, through cough etiquette, through hand hygiene, and all the other measures that we're promoting time and time again. But there's the first problem. If you are poor, you don't have so much water with which to wash your hands. You don't have so much opportunity in your home to practice physical distancing if you yourself think you're ill. It's so hard to isolate yourself. You don't have so many opportunities in your work to be able to physically distance. You don't have a nice office where you can just sit further away from somebody. Your work involves going up close and being close to people. And you don't have so many opportunities in your social interactions or where you sleep sometimes to be physically distant. Just look at the problems faced by people in the communal dormitories for visiting workers in different parts of the world, or the dormitories where migrant laborers working in agriculture sleep, or the facilities for crew on ships, particularly cruise liners or merchant ships or even naval ships. They're often very close together. Poor people in many situations are required to sleep very close together, to live very close together. So for poor people, that defending against COVID is not as easy as it is for wealthy people. And poor people often don't have the luxury of being in the kind of employment where they know that their salary will be guaranteed. If there's not work available and they're in the informal economy, they've got no defense. And so another feature of poverty and people in poor societies being defended against COVID is that often it just is not economically feasible for them to practice physical distancing in the way that's required of them. So the first area of societal defenses against COVID that are so important for being able to interrupt transmission of the virus, that area is tough on poor people. Then the next aspect is that if there is an outbreak, then authorities need to come in support of the people and actually suppress that outbreak as quickly as possible. Now, outbreak suppression does involve restrictions on people's movements. It's right at the heart of it. And it does involve asking people to stay put in where they live and not to move around. But as soon as you start to impose restrictions on people's movements, that in turn can be an extra disadvantage for poorer people. After all, they're being asked to stay at home. They're being asked not to go out. and they're being asked to obey certain rules. But I'm hearing more and more from poorer people that they feel sometimes that there is discrimination against them, that they feel that they're asked to pay an extra price when movement restrictions are brought in. That wealthy people find ways to get around the movement restrictions, but poorer people feel very much that they are a bit at the mercy of those who are imposing movement restrictions. So there's a huge requirement that outbreak suppression, when it is implemented, puts the interests of poor people first. Remember that they may not have much in the way of savings. Remember that they may not have stocks of food at home. Remember that their children depend on being able to get food from the school or from the childcare centre. And when they are asked to stay at home and their movements are restricted, so their children may end up getting much less good nutrition. And also, for many poor people, being asked to stay at home can be very, very restricting, especially if home is a very small space. And sometimes they need support and they need help, perhaps even in the case of severe need, to be able to get out of the home because they're stressed and they need mental support, mental health support, or other support. So we do need to make sure that the interests of poorer people are taken fully into account when outbreak suppression is put in place, and that's really significant. Then there's a third thing, that when COVID comes, it changes the way in which different parts of our society have to work. It's changing the way in which hospitals work. But as one of you on this briefing has reminded me time and time again, you don't just think about the COVID side of a hospital or a health facility and care for people with COVID. That's important and it needs attention. But what about all the other health services, and particularly the health services on which poor people depend, on which public hospitals are their only source for support? Where do they get their contraception and other family planning support from? Where do they get abortion services if they need an abortion? Where do they get facilities for treating common illnesses if they get an injury or something like that? They can't go to a private practitioner and pay money. They haven't got the cash. So they're hugely dependent on state hospitals. But many state hospitals are being overloaded because of being repurposed for COVID. And so basic access to healthcare is critical for poor people. And we've got to protect that. And then many of the people who work in hospitals, especially when they're dealing with COVID, in many functions are low paid. So I read quite recently reports from hospitals in the US reminding me that it's not just the doctors and nurses who are at risk. It's the people who move patients around. They're called patient transport assistants or hospital porters. It's the people who bring food. It's the people who do cleaning of all aspects of the hospital. They're at risk as well. And some of those are getting COVID. So there's again an issue, and often the cleaners are the people who are least easily able to demand the protective equipment that is obviously preserved, and rightly so, for those who provide direct patient care, but they need help. And let's think about other areas. Residential care for older people. Again, many of those working in residential care facilities are poor. Many of them have to do 2 or 3 jobs in order to make ends meet. And so making sure that they can get the care they need is absolutely key. Get the support they need is key. And again, we must think about poorer people working in residential care, whether they're protected and supported. And what about people working in food? Again, most of the people who work in agriculture are poor. The migrant laborers are poor. The smallholder farmers are poor, and they are being really badly affected by the consequences of COVID right now. They're going into greater debt. Some of them are getting very stressed. They may even be at risk of suicide. So bear in mind that inside the food system, it's again poor people who are suffering the most. And of course, it's poor people who can't get access to the food they need. Throughout the world where movement restrictions have been put in place, it is the poor who are suffering, who are short of food, short of all the food they need. And then let's look at what's happening in all aspects of different sectors. Again, let's look at hospitality and travel. There again, there's a huge number of people, multiple millions of people who earn their living from being in the informal economy linked to hotels, linked to the travel sector. They may again be on daily wages, but suddenly their opportunities for employment have contracted. In Colombia, in Costa Rica, I'm hearing of huge unemployment of people in the tourism industry. We have a colleague from Gambia on this call. I'm sure there's terrible problems for people in Gambia at the moment because of the collapse of the tourism sector there. Perhaps it's not the case, but it's my hypothesis. And I don't know whether that's the case. Nazim, I see you nodding. Perhaps you're telling me that is an issue where you are. These poorer people in the tourism sector in your country are in huge difficulty. And remember, these are often not people on salaries. They're often getting their employment from being around where people are in hotels and offering them handicrafts or other such things. Where's their market gone? It's dried up. And these are people who've got the least capacity to be able to adapt to it. And so that's the truth, that COVID and the containment measures that are needed for this virus are leading to a huge increase in unemployment of people in the formal sectors, in the informal sectors, on daily wages, in all parts of the world, all parts of the world. Obviously, in India, it's been an absolutely massive problem, and there are millions of people who are at the moment migrant laborers who are neither able to get employment in the places they migrated to, nor because of movement restrictions that they're able to get home. They're kind of locked in a rather strange no person's land, and there are tens of millions of people in this situation right now. And it's not the stuff that we read about in the newspapers, but it's what we're picking up through all our networks of people who are telling us what they are seeing. Yes, they're seeing huge and wonderful examples of community resilience, but they're also seeing that the new reality is leaving lots of people behind, and that the non-governmental organizations, religious organizations, local help organizations, even NGOs linked to companies, a lot of those have had to reduce their activity. Even close to where I live, where there is sheltered housing, the daily center where people come together to meet and get access to welfare, that's closed. It's just closed because that's part of the restrictions. There are services here. There's food services for people near where I live who normally can't get a meal a day, and that Resto de Corps, it's closed. And the same, we're seeing food banks. They're setting up some kind of special facility at the moment because they've realized it, where there is kind of low contact or physical distancing. But still, a lot of the basic facilities for poor people in European nations are not working. And so in all the new reality, whether it's in hospitals or residential care or food systems or transport and hotels, migrant labor, and many, many other areas, and I want to add one more in a minute, they are all affected by COVID, and at all times it is poorer people who are feeling it much worse, and the support systems for them are stretched. And I want to pick on one particular area that I'm hearing about more and more, and that is the whole area of law and order. Both, whether it's the military or the police, there is now increasing shortages of personnel because of COVID. Some military are telling me that they've been very good, that through discipline, they've been able to reduce the infection risk. But I know of very high staff shortages in many police forces because of COVID. But what does that do when you've got running a huge detention center or a prison? You basically have less staff. And anyway, you've also had to reduce visiting because they're worried about COVID through visitors. So what does that mean? It means that your people in the prison or in the detention facility are really upset. And so you get another additional factor that adds to the burden for people concerned and adds for the people who are providing care. And that is social unrest. And that is a major problem. I was just reading of a major prison riot in Democratic Republic of Congo yesterday, all linked to the COVID reality. And then the fourth thing, I'm going to just give you a revision of what my 4 parts were, because I'm sure I've been a bit disorganized. The fourth thing is about how we deal with all this. How do we, as a community, react to it? How do we internalize it? How do we bring it into our thinking? Well, the first thing is that we ourselves, all of us who are involved in this, have to be conscious that COVID is revealing enormous inequalities. COVID is contributing to inequalities. COVID is a challenge for poor people, and it's one that all of us have to bear in mind. Whenever we're making any statements or judgments about COVID and people, we have to hold close in our hearts that it's not affecting everybody in the same way. Poorer people are being affected really strongly. Poorer women in many settings are finding it particularly difficult. And at the same time, older, poorer people are facing challenges because they are vulnerable and they find it very hard to protect themselves. So that center of cooperation is all of us just being conscious that COVID is revealing inequalities and that the containment of COVID is affecting people unequally. But what I want to stress is that in dealing with a problem that is affecting 7.8 billion people and that is associated with huge inequities, there's one thing that really matters, and that is that we all work together as a human family. And when we don't try to say, oh, well, we know better than you, we've got better answers than you, we're going to try to deal with it independently. Or even worse, we're richer than you, we're fine, and you who are poorer, well, you'll just have to work it out for yourselves. That would be terrible. But there are signs to me that that kind of fragmentation and lack of cooperation is a characteristic of what's happening in COVID. Fragmentation within countries, within European countries, I'm seeing it. Different parts of countries adopting different strategies, thinking that it's the right thing to do, that it makes them really more acceptable to their electors. And whilst I agree that decentralized decision-making can be really helpful, the one thing that I want to stress is that if you don't have an agreed national strategy with a series of agreed strategic principles that are clearly articulated, and then they're adapted at local level, then things go wrong. Because when people travel from one part of the country to the other, or when people are comparing notes from one part of the country to the other, they get super confused. It's an issue in Europe. It's an issue in North America. It's an issue in many other countries. The importance of internal consistency and collaboration within countries has never been greater. But perhaps the area that needs the most attention right now is collaboration and cooperation between governments. You see, our world is not run by some kind of global government. It's not there. We have governance by nations, and then these nations consent to create governance of the world through something called the multilateral system, of which the apex organization is the United Nations, and it consists of about, well, I'm not going to say about, it consists of 22 specialized agencies that deal with particular areas of need, and then many, many more other organizations that are part of the United Nations system, but they are all running thanks to the collective activities of 193 or 194, depending on how it's divided up, different governments of individual nations. And that's the global governance system. And unless that works with total cooperation, with total sharing, with trust, then we're stuck. We get fragmented. Now, the good news in health is that the international community of public health specialists, public health actors, public health students, and that's many more than the people who've got public health degrees. That's just about everybody who's working for the health of everybody. That international cooperation, fellowship, networking is stronger than I've ever known it. Stronger than ever. Because we all work for one value system. That is, all human beings are equal. And we focus on inequity. We want to be sure that everybody has as good an opportunity as possible. We struggle day in and day out with the fact that what is plentiful in terms of medical equipment and support in richer countries is in scarce supply in poor nations. And we want to do everything we can to deal with these terrible market failures. We're not interested in talking about it. We're interested in acting on it. But then there are other features that really concern us, and that is the need to make sure that everybody everywhere gets accurate information about what the science tells us, that everybody gets good and up-to-date information on whether treatments are coming available, that if there's a vaccine developed, that every people in every nation will be able to access that vaccine, and that any information we've got on what works best in different settings in terms of physical distancing or outbreak suppression or shielding older people or being able to look after hospitals and health services or keeping food systems going, we want to be sure that that information is shared openly and widely, because we believe that cooperation is the only way to go. And I suppose that I am not going to stop at all from continuing to make that point wherever I can, because I just see absolutely no virtue in any approach to dealing with a global issue which allows the differences of opinions between political leaders to interfere with the collective working of public health actors and specialists, or the functioning of the organizations that have been created by all these governments, like the United Nations, like the World Health Organization, that are here for a purpose, and that is to lead the world when dealing with major international health emergencies. Equity is a key issue in global health. And in order to address inequities in global health, we only have one body, and it's called the World Health Organization. And for us, it is a kind of meeting place. It's been my meeting place with other health experts for decades. And I don't want to see anybody destroy that organization by taking money away or by in any way creating some kind of massive suspicion about what that organization stands for, because it's the only thing we've got. And I have studied how this World Health Organization has operated for decades, and I see every sign that they're working within the boundaries that have been set for them by the member states who own it. And they have said, here are the rules that you operate under, the international health regulations, and you've got to work within those. And there are rules for the World Health Organization Secretariat, and there are rules for countries. But it's amazing to see how many countries are following the guidance of the World Health Organization and the international health regulations, particularly poorer nations. And do you know, they seem to be doing remarkably well, considering all the challenges they face, but they need all our support. So there you go. That's my view of the four things. Let me revise. Number one, what happens in the face of COVID, which is going to stick with us, depends on all of our societies and all of us being COVID ready. As Nazim has pointed out in his anthem that we're featuring on our website, that is what the future is all about. It's all of us getting ready to get on top of and get ahead of this virus, and to be able to have fun and to live and to earn with that virus in our midst. Number two, it depends on how good we are at suppressing outbreaks of this virus and doing it in a way that is responsible, that puts the interests of everybody, but particularly poor people with the greatest needs, right at the center of all our attention. Thirdly, it depends on how we're going to readapt the reality in different sectors, whether it's health, whether it's transport, hospitality, food, law and order, residential care. How we adapt these sectors to the reality of being COVID ready is hugely important, and we must do it taking account of the interests of poorer people right at the center of our thinking as we establish new ways of being COVID ready and working. And number four, none of this makes any sense, particularly for poorer people and poorer nations, without full international collaboration and cooperation, without full cooperation within countries, without full cooperation within communities. Then we can deal with it. But if we don't, it will defeat us. And that will make our world a much less good place. I'm seeing lots of examples happening. So it's 28 minutes past. Rojan is here.
Yes, sir.
I'm just looking for you. Are you still on? There you are, Rojan. Let's give the mic to Rojan just for a minute. Can you unmute Rojan, please, Tweet? Just to give him just a couple of minutes, please, Rojan, not long, but could you just say what you're about to say? Rojan, you're live.
Yeah, thank you, sir, providing me an opportunity to
You should be live.
The remittance
Not
is
quite live.
Yeah.
Hey, well,
Can you hear
I'm
me?
going to say what you said in your message to us. We just can't hear you at the moment.
Okay.
Check to see whether anything can be done to mend that. But Rojan points out that countries that are largely dependent on remittances from their diaspora are finding it difficult to cope with the economic consequences of COVID-19. Rojan, thank you. Rojan is in Kathmandu. He and I have been working together quite a lot. We exchange on Skype and so on. And he's been pointing this out to me for some time, but I've heard it from several other people that remittance funding has reduced and that this is making it very, very hard for people all over the world. Thanks for that point, and let's hold on to it. Let's keep talking about it, because actually that's another reason why non-governmental organizations are so important, but perhaps we also need to appeal to those who normally do remittances through Western Digital or through other similar mechanisms. Please don't stop. Your remittance money is needed more than ever now. We'll bring that into our narratives, Rajan. Thank you. Who's in our team? I just want to introduce them to you, but I'll do it quicker than usual today because I have a fair number of questions. John Atkinson is here and you can see him, he's live. He deals with all our systems leadership work and has done much of the writing on systems leadership. I'm just going to change something now. Can I change it or not? So I can hear Rajan if he wants to speak, or is it too difficult? Okay. Can you work it on your computer so that if we do try again, I can hear it? No, you can't. Okay. I'm not going to be able to hear you today. I'm so sorry. It's just a problem with the way we've configured things. We'll do it differently next time. I'd just like to introduce Tweet and Goyen. You can see her. She's not connected her video. Oh, she's done it briefly. That's because the bandwidth in her apartment is so limited because everybody's streaming, I don't know what. And so anyway, Tweet, you're here. Thank you. Thank you for being with us and for keeping us all together on these webinars. Catherine Deland is sitting there. She's just lit up and she's waving. She deals with all our health issues. She's a lawyer who works on health issues. I've known her for years, and she's just really understanding this issue of equity from where she works and for her connections through her ancestry to indigenous communities in the US, where she's feeling it really strongly right now. Joe Colombano is our economist. Joe's here. He's been working on the Sustainable Development Goals, and he's been with us for the recent past as volunteering, but he and I worked together for a long time in the UN. Thank you, Joe, for all you do. Magali Mahdi, who's joined us from Terres Hommes, and she's here and she's waving. Thank you, Magali. Sabir Moumel, if you're on, he's coming from Tunisia, and he's very much connected to his community in Sousse. He's not on today for various reasons. Julian Delamontex, who's part of the mayor team, he's not on. He's from the mayor team in Flen, and he's saying hello. And Florence Lasbens, who's next door to me, who's managing director of 4SD. So we have people with us today, actually many more than usual. Thank you all for joining. From Norway, from Mexico, from Cairo in Egypt, from Nepal, as I said, from the Gambia, from Morocco, from Kenya, and now from Nairobi, by the way, from different parts of Italy, from Vancouver in Canada, thank you again for being with us, from the USA, and from the UK, from Scotland, from Liverpool, from Nottingham, from Brill near Aylesbury, my daughter, and from London. And then we've also got participants from Geneva, particularly from Switzerland. I love it. We are a family. We're connected. We will stay connected. We will stay connected through COVID and beyond. We won't be necessarily rigidly connected, but we will share with each other. All of you will be able to connect with me and with my team through contact@4sd.info. But also, if you want to get in touch with us, do join through these chats and we'll find ways to connect with you. That's one thing that seems to work these days, at least for now, is that connecting through lots of different means like LinkedIn and the rest seems to be working. So the first question comes from a colleague, Linda Bayer. I hope you don't mind me mentioning your name. If you want to be anonymous, please tell us. You are from University of Oxford. You're based in Nairobi. And there you are, Linda, you're putting your thumbs up. Thank you very much indeed. You're doing research on what happens in densely populated settlements, or sometimes called slums, and you're very concerned about some of the things that are happening there. So Linda, so am I. Most of my information comes from fairly detailed discussions I'm having with people working in Mumbai, in the slum there. I've mentioned that in previous calls. And here's the situation, and we all know it, that the whole process of trying to help people to isolate in order to reduce transmission involves asking people to stay away from others. But in very, very densely populated settlements, isolating an individual is really hard. So you end up isolating a family. And then if actually isolating a family is difficult because everybody is so cooped up together, then you end up isolating a whole community. I've described before in my experience during Ebola, seeing isolation work in West Point, a part of Monrovia in Liberia, or similarly seeing isolation in parts of Freetown in Sierra Leone. It gets difficult. It gets difficult because people don't like being told they can't move out of where they live. Their whole existence is about moving out of where they sleep and going and doing projects or doing activities or buying and selling or whatever else outside their home in other parts of the city. And that's the way of life. And then you come back and you sleep, but you don't actually live in the slum, not much. Okay, I'm lying. Of course, you do live in the slum because that's where you sleep, and often your family are in the slum, but an awful lot of life is done outside. That's the way it's done. And so, of course, asking people to stay at home, be isolated in a densely populated settlement, what might be called a slum, when actually getting out is the way of life, is really hard. And of course, these become very, very tense and sensitive moments. And so often security forces or police are deployed to actually make certain that the isolation is respected. And then there are challenges about getting water, getting food, accessing the toilet. And that's when the difficulties build up. And we know that it doesn't go so well sometimes. And we know that it's really tough, actually also for the security forces who are asked to maintain the line and to hold it. And then at the same time, people are getting upset. And that's when arguments build up. And you see it, people get very, very tense. I don't have an answer. I think what I'm doing all the time is I'm saying to people, just bear in mind how tough it is to do this physical distancing and isolation in very densely populated settings. I just want to go to Singapore, and it's widely known now that in one of the residential dormitories for visiting workers in Singapore, there has been a big COVID outbreak. People sleep 8 or 12 in a room, and they're not very, very spacious, these rooms, and there's no way to isolate. And then there are communal facilities where people eat or where people do bathroom, and they're very hard to keep good. And so what we're actually learning is that the conditions under which people are living in so many settings are just not good enough for the kind of social distancing that we're asking for. It's a really massive issue. And I totally agree with you, Linda. It's something that needs all of our attention. Firstly, we've got to be super respectful and listen to the people themselves about how they would like to practice physical distancing. Secondly, we've got to be listening to them on their needs. If they're worried about food, if they're worried about water, we've got to find ways to deal with that. Thirdly, the way in which the isolation is regulated and enforced needs to be done with the utmost tolerance. We've all seen how really, really good enforcement officers can do it beautifully. I've seen it time and time and time again. I've often said that in controlling disease outbreaks, the police, the military, can be absolutely brilliant, and it's super important for helping to maintain the isolation. They support people because people are confused. They don't know the rules. They don't understand what's going on. So I want to stress that in this, a whole process of working together and learning from each other is absolutely the key. So let's do our best to try to support people as they make this happen. I go to question 2. What can we learn from countries that are beginning to open up after lockdown? How do we know when it's the right time? I'm often asked this if I'm doing interviews. People say to me, you know, we've been in lockdown for 6 weeks. Isn't it time we loosened the lockdown? Or we've been in lockdown and we see other countries are coming out of lockdown. Shouldn't we be doing the same? And so I have to say there are increasingly now a set of principles that countries are adopting for deciding when to release lockdown or not. Obviously, at the center of this is how much hardship is happening as a result of the lockdown. Because none of this is absolute, you know, either you lock down or you have a lot of ill health and a choice. No. It's all a question of weighing up risk, weighing up the risk of disease versus weighing up all the risks associated with movement restrictions and the possibilities of unemployment and or poverty. So a lot of the work that is being done in coming out of lockdowns is about political leaders on behalf of their people making really difficult judgments about what they're going to do. And that's why they've been put in power, these political leaders. They are elected in position or they're appointed in position to take responsibility for weighing up on really difficult issues. But then there's one core feature in the middle of all this, one of the principles that WHO has developed, which is come out of lockdown when you're confident that your societies are ready to be able to defend themselves against this virus, and come out of lockdown when you're confident that your public health services, as well as your hospitals, are still able to keep functioning and to function well if there's an increase in the number of COVID cases because of an outbreak building up. It's that key feature that I have to keep making, a point that I have to keep making over and over again, is that lockdown buys you a bit of time. It freezes the virus in place. When you release lockdown, you're going to get more transmission. What you've got to be able to do is to interrupt that transmission quickly and suppress outbreaks quickly and do it well. And that gives you the assurance that you can come out of lockdown. That's what's happened in Singapore. They had to reimpose movement restrictions in part of the country because of the new flare-up that they've got. But that was okay, that was planned. Then they were expecting it in a way. And ditto in Germany and Austria, they've released the lockdown because they believe they've got the public health services in place. They've got quite widespread virus testing as well that helps them. So they're doing good and they're doing right. It's basically getting the balance in place, but taking advantage of what we know about what needs to be done in terms of getting basic health in place. Question 3, many more people are living on the streets. Many have no shelter, no tents, no addresses, no identity for applying for medical or living help. Yep, this is actually not come from Nairobi, Kenya. This has not come from Mumbai. This has come from Vancouver in Canada. So I'll read on. Not only are more people on our streets, not only are they unable to get help, but they're also turning to solace. They're injecting more. And we know that happens. I was in an earthquake in a Middle Asian country some years ago. Do you know what I found? When people are in distress, they turn to substances for help. And the clever people who are selling the substances, they lower the price. And so you actually do get more people using in those circumstances. And our questioner says, the opioid crisis is on the rise dangerously. There's a lack of safe injection sites in lockdown. People are sharing needles. They're putting themselves in harm's way. What's the right thing to do? Well, I'm not in charge. And so I'm very, very careful of giving advice. But I think if I were in charge, I would say, remember when we're trying to deal with this virus, all of society is involved. Everybody. The wealthy, able to work from home, able to stay connected through the internet like me, but also those who have very, very little, who are living on the streets, who depend on getting a meal from the services, who actually depend on safe injection sites for the way in which they inject themselves, who depend on communal facilities for washing and the like. And we have close contact with a homeless man not far from here. And he says it's been really difficult. All the facilities that they normally use are shut. Keeping clean is difficult. Getting food is difficult. And even because he earns his money busking in the street, even being able to get his living from collecting money is difficult. He's got ingenious workaround ways, like he gets the street to do a concert, banging their pans and so on, but it's really hard. So I think that the only way forward, as you put it in your question, for these souls, is to recognize that in responding to COVID, we are one human family, and we have to have the interests of everybody in mind and not just deal with those people who are convenient to think about and work with. Everybody matters. And please, all of us, keep reminding each other of people for whom this is really, really hard. Question 4. COVID is considered to be a zoonotic disease. You work at the intersection of public health, nature, food, climate, and sustainability. Could you elaborate on the interlinkages across these systems and what can be done to understand and respect them? Yeah, you're right. I don't know who wrote the questions, somebody who knows what I've done. But anyway, you're right. 75% of new microbes that affect humanity come from animals. And not just, I'm talking about domestic animals. Actually, they come from the wilder animals. And that does mean that we do have to be respectful and careful when we are keeping wild animals up close, especially if we're going to take them and cut them open and cook them. There are risks of getting viruses from wild animals. There are various pathways through which they come to humans. Either they may come from a bat to a wild animal to humans, because bats are really amazing virus reservoirs. You've got a whole museum of viruses inside a bat. Or they may go from wild animal to bat to human, mostly through the feces of a bat. Either way, there is a pathway through which viruses jump. And we have to understand and respect that. We have always said, those of us who operate at this interface, that we've got to be respectful of the possibility that new pathogens will come from the wild. And we have to build that into our thinking and working. Again, we have to bear one thing in mind. Poorer people in many countries make a living out of trapping wild animals and selling them, either alive, in which case they can be taken by the purchaser and then killed and cooked at home, which people like to do, or sell them, having butchered them, as bushmeat, dead. Quite honestly, it's the live animals that are more worrisome. But if we try to stop the trade in wild animals because we think that it is bad for health, we've got to remember that a lot of poor people depend on this for their living, and we might end up putting them out of work. So all these kinds of measures have to be done thinking hard about people who depend on it. Just as when we're talking about protecting forests, we have to remember that there are thousands and thousands of people who earn their living who depending on forests. So protecting forests doesn't mean keeping the people who depend on them for their living, and actually who are often the guardians of the forest, outside forests. All these things link together. Question 6. What about vaccines? Oh, I've missed out question 5. Okay, I may have put it down somewhere. Anyway, I'll keep going. What about vaccines being trialed in the US, Europe, and China? What's the latest thinking on vaccines? And if one comes, how will we know it is safe? Wow, tough question, important question. I got myself a little bit notorious for questioning about vaccine availability recently, so I'm going to give you my straight answer. The trials that are being done are trials of candidate vaccines right now. It's checking to see whether a substance, a compound that's based on the virus is safe for use in humans. And so that testing comes initially in animals. And yes, animals are used for this purpose. And I personally think it's a very legitimate use of animals. And then secondly, it involves testing in human subjects, first volunteers, then human communities, and then what's called the phase 3 trial, which is a very large scale, multi-human trialing of the vaccine. But you only move into those phase 3 trials after you've had stringent testing, both of efficacy, does the vaccine work? And secondly, safety. Does the vaccine cause any potential risk to the recipient? And that's risk in terms of actually injuring the person as a result of the vaccine itself, or injuring the person as a result of the antibodies and other immune responses to the vaccine, causing what's called an autoimmune reaction, like we had recently with a candidate vaccine for dengue. And so that safety and efficacy study is a really, really important step. And I want to ask everybody concerned, don't short circuit essential efficacy and safety studies because this is an emergency. There are some people who are saying it's so important we should go for some kind of special licensing or emergency use legislation, but I've seen how vaccines can lead to some health impacts, and I have seen how this has massively dented confidence in the use of vaccines by a whole community of people who are now called the anti-vax movement. And I think we have to respect the views of these people. We have to respect their concerns, and we have to do everything possible to ensure that we're putting safety at a high priority. So how will we know it's safe? Answer, through going through the protocols, but going through them properly and not short-circuiting them. They exist for a reason. And how long will it take? Your guess is as good as mine, but I think it's a minimum of 18 months and more likely longer, because it's likely to be several vaccines that come along. They will need to be tested. And we don't know enough about this virus and the immunity and immune response, and how the immune response is in some cases part of the illness. There's still more to be learned. And I got a feeling that we're going to find out some more news about this virus that will influence the rate at which vaccines can be developed. Next question. Actually, now at 6. Every person living inside an informal settlement is a vulnerable member of our society. While these communities are known for their strengths to mobilize and self-organize, what are the safety nets for informal settlements? Are there any examples of practical solutions? I think we need to collate every possible example we have. I have colleagues who are in Kibera in Nairobi who are telling me about self-organization they're doing. I think it's very, very important that in that self-organization, the voices of women are heard and the interests of children are reflected, and it's not just the men doing the organization. I think that in the self-organization settlements that I've heard about, the best part of it is when local leaders are involved in the organization and they're getting the best results. But I'd like to use this opportunity to ask any of you who've got examples to send them in and share them with us from any part of the world, because most people live in informal settlements. It's not the majority who live in apartment blocks or houses like the ones that I'm living in. And that's why we've got to be well organized so that we can learn from experiences in different informal settlements, even when these local organizations are not necessarily those that are always on the right side of the law. Let's listen to them and what they've got to say about how people can be kept safe and how people can organize so that their interests are properly looked after. Next question. 7, as countries in Europe begin talking about going into lockdown, when is the pandemic expected to peak in Africa? And there's a second question as well. Do you think that countries in the African region would benefit from the experiences gained in Europe in dealing with the virus? And this comes from our colleague, Marianne, in the Commonwealth Medical Trust. Thank you, Marianne, and I can see you. It's great to see you here. So, most important thing is to know that the outbreaks that are going through different developing nations have got a slightly higher rise than what we saw in Europe, mostly because the poorer countries realized that following the European example of waiting before actually getting really tough on this virus was a mistake. And they imposed physical distancing quickly. They imposed movement restrictions quickly. And so I think that their peak is going to come slower. And I think that it will be longer to develop. But I think they will also be much better able than European countries have done to be able to at least put in the community level defenses and help people know what's coming so that they're better prepared. But I do think that they're going to face challenges in dealing with the consequences of the virus, particularly for older people. And they're going to face challenges because of the poverty associated with containment measures. So I hope that they will benefit from aspects of the European experience about particularly enabling poorer people not to be disadvantaged. And so paying attention to the interests of poor people is absolutely key in any aspect of the African response. Lastly, I would say that what Europe has learned is that COVID does restrict people's access to other healthcare besides COVID-related healthcare. And I hope that in African countries, we will follow what we learned was necessary during Ebola, which is maintaining care for people who've got conditions other than COVID in as many hospitals and health centers as possible. Because otherwise, we will get really, really major consequences for poor people. I've said it twice on this briefing, but it's important to me. Question 8, COVID-19 needs a whole community response to defeat it. As a musician, I use music as a medium to communicate messages and bring about positive change. I think I know who I'm talking to. I can see you there. I can see you in my screen. How can we successfully combine multiple communication channels to engage with and reach, and I'm going to say here, everyone. The Nazim, you wrote the hard to reach and vulnerable groups, for everyone. I said just now, this is a sense-making exercise for everybody. It involves 7.8 billion people at the same time. The only way we can be helped to make sense of this is if the messages about this virus and what we've got to do in relation to this virus actually touch us in our hearts and in our souls. We have to connect with this issue emotionally. None of us change what we're doing simply because of what this thing up here says we've got to do. We decide what we're going to do because of what our hearts and souls are telling us what to do. And that's to do with the feelings that we have about ourselves, about our close relatives, about those we love, and about the wider human family. So to all of you who've got music, who've got poetry, who've got dance, who've got any other skill that you can share that touches people emotionally, please do it. Do it more. Do it everywhere. That's what matters more than anything else at this time. And take advantage of the internet. Take advantage of television. Take advantage of anything you've got to share the messages. Touch people's emotions. It's not going to be done through heads. It's going to be done through hearts and souls. All of us, children, women and men, working together. Thank you, Nazim. Question 9. How do you see the level and type of resilience reflected in how different societies and nations are responding to the present situation? What can be learned for the future? That's from Zenda. Thank you, Zenda. Beautiful. So here it is. This is all about resilience. You know, as communities everywhere are having to cope with the horrors of climate change, many countries coping with awful changes to the seasons, it's about resilience. It's about your inner strengths in coping with things that are thrown at you by fate that really are tough to handle. So resilience is at the heart of everything. And actually, this resilience in the face of a disease threat, it's one other factor that has to be bound into the resilience of societies. But I am finding everywhere, from connecting with our friends in Forest D, that it is resilience, and it is our ability to collectively be resilient that matters. Somebody says, the last question, I'm concerned about poor health systems where a lot of privatization has happened. Please give a message to private hospital doctors who work in the developing countries. All I'm saying is, all of us who are into health, public health and healthcare, we have to work for everybody. I understand that you've got private hospitals and public hospitals, but I've seen here in Switzerland, the private hospitals are working alongside the public hospitals, sharing the load, offering staff, being part of the total response. I think that has to be the case everywhere. I was listening to the governor of New York State saying just the same the other day. We're all in this together, public or private, business, non-business, civil society, university, musician, dancer, family carer, looking after older people, whoever we are, we're in this together. And the future is determined entirely by how we work together as part of this great family of humanity that's been given this test. Can you, humanity, respond to this test in ways that are equitable and fair and lead to a better future for everybody? If you can, humanity, you can deal with the other tests that you've been given, like climate change, like the destruction of nature, and perhaps most importantly, like inequity. I couldn't hear you. I'm sorry for that, because we set the microphone up differently today for a particular reason. We thought it would give better quality. We'll fix that for next time, because I want to be able to hear you. I want to be able to give you guest moments. I thank you. I thank you all for coming. We'll connect again next time. It'll be on Thursday if you're around. It's early in the morning in European time, or it's this time next week. We'll do it at the same time, same style. We'll try, as I say, to be a bit more responsive. We'll always have a theme. We'll try to tell you the theme in advance. But just for now, and I think for the foreseeable future, it is about inequality, because I think that really matters. So thank you very much indeed, and love to all. Bye-bye. Thank you, Gabriella de Souza. Nice to see your message. Rojan, I've opened up. If you can open up your mic, I could just speak to you 2 seconds in Nepali. It'd be lovely to hear you. Oh, you've gone off. Okay. But for all of you who stayed on and stayed through. Oh, there you are, Rojan. Come, कस्तो छ तपाईलाई?
मलाई ठीक छ, हजुरलाई कस्तो छ?
म राम्रो छु, तर त्यो काम एकदम गाह्रो छ. तपाईहरुको लागि त्यो खूब गाह्रो छ. Thank you for the messages.
It's very difficult since we are bordering with India.
Yes.
Cases are rising very sharp. We are open border. People are coming in and out from India. So the situation is much more tense in absence of good containment strategies and mitigations measures. We may find difficult in coming days. So we together have to make a difference.
We should keep connecting through the Skype chat, Rajan. I don't have any solutions. You can't seal your border, you know that. And anyway, the virus is in Nepal now. It would be inappropriate. But what is necessary at all times is to try to help communities understand that it is in their power to be able to interrupt transmission. And I appreciate that just at the moment it's tough for you. And I send all my best wishes to the Health Ministry and to all who are working for public health in Nepal.
The other challenge is that Nepal is largely dependent to the remittance.
Yes.
Since many people are working in the Middle East.
Yeah.
Now they are means they are losing their job as a result of COVID.
Yeah.
So the country is finding difficult to cope with the consequences. So more challenges coming in near future.
Well, one of the things we all have to do is to make sure that Nepal and other countries who've got very limited cash in the Ministry of Finance can get money from the International Monetary Fund easily. And I know that's not where you are, but I have been talking a lot with people in the IMF to make sure that they prioritize countries who are really, really dependent on external support like your own. The remittances thing is really important. We've got to work through all the connections we have with the diaspora to say, keep the money flowing. Rojan, thank you for these words. Nazim, if you're still there, if you can unmute, just give us a couple of words from the Gambia. You should be.
Hello, everybody.
I can hear you, yeah.
Okay. For my side of the Gambia, it has been really tough because to stay indoors all day, and then for people who have been working, and then all of a sudden you have to stay put one place, it has been tough, even for myself here. But like my question read some minutes ago from Vicky, I was wondering how I can engage, how we can engage people with music,
Yeah.
to bring this together. For the youth, we need a friendly medical manner to approach things, because I think medical workers here have been a bit judgmental.
Yeah.
So that makes the youths not to respond accordingly, because at the moment, people are being tested, but
Yeah.
people don't want to go out to submit to be tested. And this is difficult because medical workers have been very judgmental. So it's a difficult thing, but we believe if we can take the musical route, it will be very easy to encourage them to submit to it. And we all know that testing is the only better way to handle this COVID-19,
If you've got a test, you should be tested. That's the only way you know where the virus is. And anything you can do with music and dance to try to make it clear to people that this is a cool thing to do and not a bad thing to do, and get the health workers to do it as well, that might level it up, because I'm a bit nervous when you say the health workers are judgmental.
Yeah.
That's not going to make it easy.
A little bit.
Well,
so that makes the people to hold back a little bit,
Yeah.
Yeah.
So if you or Vicky would like us to do anything we can to connect you with people who are active in this business, in the music side, some of them are coming forward. We'll do our best. We don't have a nice sort of filing list of everybody who can be helpful, but I get your point, Nazim. Anything you can do to get the message out. And if you get any stories of uptake of your song, do share them with us. And if you've got more songs in your back pocket, just let us know. We'll do what we can to be helpful. We want to feel that we're part of your team. Thank you.
Okay, sir. Thank you.
Okay, so thank you both Rojan and Nazim. And with that little extra 7 minutes of epilogue, I'm now going to tune out and get on. But special thanks to my daughter Polly, who's there on her husband's computer. I can tell you're still there. And thank you for sitting there and being there and showing us my grandson, who might be somewhere near. Thank you. Bye. Okay, tuning out now. And I appreciate it's tough. And just because something's tough, don't feel you shouldn't tell me. Because that I know it's so difficult. Mark, thank you for being on. I can see your face as well. I hope you're doing okay wherever you are. M-A-R-C-K. Okay, bye. Thank you.